and welcome to the Spawdcast. My name's Carrie Hyde, and I'm your host and your pet's life coach. Today, we're going to be talking about something that it might not be very comfortable, and I'm just going to shout that out there. So before you get ready to listen to this, sometimes it's really hard for pet lovers to kind of think about our veterinarians not necessarily doing exactly what we would hope, which is to set our pets up for success. And unfortunately, sometimes veterinarians can be setting our pets up for failure, and it's important that we talk about it so we can recognize the signs. And so I'm bringing someone on the show that I'm really excited. A lot of times, I have to look for people and try to figure out who I think would be really great for our listeners to talk with. And most of you know, I started I got really involved with an organization called Joey's Legacy to try to help just the way our animals are seen. And so I've been really, really fortunate to meet some really great veterinarians that have been involved in that, which to me speaks volumes as to what kind of a veterinarian would come on to an organization that is stepping up and saying that there's such a thing as veterinary malpractice, which is what Joey's Legacy does, which is how I met our next guest. And I've just kind of grown to just love her and understand, and I'm learning more and more. And so I wanted you all to meet her so that you could see, a lot of times people think I'm an anti-veterinarian person, and I'm not. I really want to have veterinarians who want to set your pets up for success. So I want to introduce you to one of those types of veterinarians that you should be seeking out. So I really want you guys to listen to Dr. Robin Cannizzaro. Hi, Dr. Cannizzaro. How are you?
I'm fine, thank you. It's Dr. Cannizzaro. Just to.
Did I say it wrong?
Yes, that's okay though.
See, there I go.
Nope,
Bad last name.
Some people have gotten it much worse than that, so needn't worry at all. So it's Dr. Cannizzaro.
Cannizzaro.
Yes.
That is important for us, because you do phone consults, don't you?
I do. Yes, I do.
So we got to make sure we'll have it in the show notes so that people can reach out to you and make sure I mess up the last name. As I told you, I'm just learning about Dr. Cannizzaro, so I'm excited. So let's start talking a little bit. I mentioned, in the introduction that we were going to talk about something that might not be so comfortable for us to talk about. You named it. I didn't want to name it because I didn't want to take credit for it, but Dr. Cannizzaro named it something so why don't you go ahead and tell us what we're going to be talking about today?
Today we had discussed, we're going to talk about something called veterinary induced diseases. And it is an uncomfortable topic overall, because one of the things that I want to say up front in a very big way is that I don't necessarily think that your veterinarians are intentionally trying to create diseases. I am a homeopathic veterinarian, which is one leg or one piece of holistic medicine under the umbrella of holistic medicine. Homeopathic medicine is probably the deepest healing medicine that exists. Other holistic types of medicines you may have heard of is Chinese medicine, acupuncture, etc. But the key thing is that traditional medicine more often than not does not set pets up to be profoundly healthy. In fact, oftentimes it'll create diseases. So if an animal comes in with a complaint or some clinical symptoms, then the aim of traditional or allopathic medicine is to just try to eliminate that symptom without treating the underlying cause of that symptom. So the problem there is that in veterinary medicine, and I was trained in vet school just as other colleagues were as well, but I went on to get further training in acupuncture, Chinese medicine, homeopathy, spinal adjustment, better known as chiropractic, but I'm not supposed to use those words. And when we venture down that path of homeopathic medicine, we realize just how much harm we do with the use of traditional medicine. So what I want to say is that I don't think that your allopathic veterinarians are on a mission to make your pets critically ill. But I think it's a topic that, while uncomfortable and may not be popular for my colleagues to know that I'm talking about, is to give you the power and the empowerment to make different choices should you choose to. And to understand why things may be going on the way that they're going on when you are going to see your allopathic veterinarian, so that it's not a surprise. And also to help you not be so angry at the vet in some respects. Because when things don't get better or they continue to recur, you're going to understand why they recur. So I think it's an important topic to cover, veterinary-induced diseases, because it's an unpleasant topic, but you can't be empowered to make a different choice if you don't hear what that might be about.
Right. And I'm really glad that you brought up the fact that it's not intentional. I've never, a lot of times I've heard people say to me, well, they just want to get money. They're just doing it to get money. And I have said many times, I don't think that's at all what it is. I don't think that veterinarians aren't rich people. They're not making millions of dollars anyway.
No.
But
maybe the corporately traded CEOs are doing just fine, but aside from the veterinary offices, which sometimes are the scariest ones to go to, in my opinion, your average veterinarian working really hard, honestly, are doing the very best that they know how to do. And if you don't know a different type of medicine, you can't do it differently. And I also want to really encourage people listening to this that I oftentimes get people in my office who are seeking this type of medicine with me or learning about it for the first time, and they feel anger and they say, well, why didn't my veterinarian suggest, this homeopathic medicine? I said, well, they don't know about homeopathic medicine, so we can't expect them to weigh in on that. And the other piece that I want to say that is going to be a little bit of maybe a poke in the eye for some of my colleagues is that I really take offense when some of my colleagues will tell their clients that homeopathy is dangerous or it doesn't work, or you shouldn't waste your time with that, or it's a waste of money, or absolutely don't pursue that. I've seen animals die from homeopathy, and they're speaking out of a place of complete misunderstanding or just ignorance. They don't know homeopathy. And if I am not going to criticize an electrician for the electrical work that they're doing, because I'm not an electrician, I may feel like something's a little wrong, but I certainly can't be critical of it and say, well, they absolutely messed it up if I don't understand how to do an electrical repair. I may know if something's working or not working, but I'm certainly not going to understand the intricacies. So if we're going to jump ahead as people who don't know about homeopathy and create a judgment, a fear, a scare, or shut people down from that choice, I just think that's flat wrong. And I don't do that on the other side of the aisle either. I feel that everybody deserves a chance and a choice to know what their options are, whether it's allopathic or homeopathic or any other holistic modality. And I feel that commitment as a veterinarian, because knowledge is power. And if we have knowledge, we can make open and educated decisions. And if you decide not to do homeopathy, you're not wrong and you're not bad. But we want to help you today, I hope, understand what you might be in for and what you might be seeing. And maybe that will help take some of the anger, fear, frustration, questions out of the equation here in what's going on.
So it's kind of interesting when you bring up about how a veterinarian might say, I've seen dogs die from homeopathy, that kind of thing. I remember many, many years ago when I was first learning about nutrition, I had a pet and I suggested a raw diet, and the veterinarian said, do you know how many dogs I see in here with bowel problems because of a raw diet? And I remember thinking, back before raw diet existed, one of the biggest reasons we had dogs come in was because they had bowel problems, diarrhea. So it's kind of one of those things where she didn't know anything about the raw diet, so she just poo-pooed it right off the bat, and then used the fact that maybe she did have one or two dogs or however many dogs come in that had stomach issues from going through that transition, but she didn't know enough about it. So I think your point is so important, that and I think it's really sad to have a veterinarian, if they can't help your pet, they should want something else that can help your pet. It shouldn't just say, well, I'm sorry, we're going to keep giving you my same medications that aren't working. If someone starts seeking out homeopathy or holistic veterinary modalities, it's because what they're doing isn't working. That's the big reason why most people will do that. So let's just back up a little bit here. Tell us a little bit about how long you've been a veterinarian, what school you went to, what led you down the path of homeopathy, and then we'll talk a little bit about these veterinarian-induced diseases.
Sure. Just before we get into that, I want to share an interesting, just a quick interesting story related to what you just said. And I have a very good friend who's an attorney. She's a defense attorney up in Boston. And we were talking about homeopathy, and she's experienced, I've treated some of her dogs. And she was relaying her experience with a local veterinarian to her that was, very violently against homeopathy, yet didn't have any knowledge of it. And because it worked so well in her dog, and she was sharing that, and it was actually being exhibited in the emergency room while her dog was there, she said, I just don't understand it. She said, we as attorneys, like if my opposing counsel uses a defense strategy that works, we're all in, like jumping in saying, gosh, I want to learn about that strategy. I want to use that in a similar case. And she said, why don't you veterinarians do that? And I said, well, why don't you ask my colleagues that? That's a good question. And that's a very sad thing. I am seeing more referrals. They're loose referrals. Oh, if you want to do that, go ahead. More support, I should say, and a few referrals. And so that's a warming breakthrough, I think, because when I first started doing this in the early 90s, it was rare or never that I would get a referral. So I graduated from the University of Florida in 1991, and I started out as an allopathic veterinarian. My first introduction to homeopathy was really unexpected, and I was working at my very first practice. And for some reason, the practice owner and the other colleagues seemed to know something I didn't know, because they always would put brochures for herbs and natural things on my desk. And I thought, I wonder why they're putting this on here. So I don't know what they thought about. Maybe I looked earthy, crunchy or something. I'm not sure. I very well could have. But I had a woman come in, and she was eclectic. She was really interesting. And they were like, oh, give that one to Dr. Cannizzaro, because they would give me the clients that they didn't want to deal with. And she was pretty eccentric. And she came in one hand, she had Dr. Richard Pitcairn's book in her hand. And in the other hand, she had several homeopathic medicine vials. And she shoved the book in my face, and she said, are you familiar with this book? And I looked at the book, and I thought, well, it looks interesting. And I said, no, I don't know anything about that book. Well, you should, and you should read it. And I thought, well, okay, and I was always pretty open-minded. So I thought, well, all right. And then she shoved the homeopathic medicines at me. And meanwhile, her cat was, deathly ill, sadly. And she said, I need you to give these homeopathic medicines if I agree to hospitalize my cat. And I said, well, I have to be honest with you. I don't know anything about these, and I don't know what they are, and I don't know what they do. And I said, but as long as it doesn't seem to be hurting your cat, I'm okay. I'll give the medicines, but please understand that I have no idea what I'm doing with them. So I can't be held responsible for whatever may or may not happen as a result of using them. So that was my first exposure. Her cat, unfortunately, did pass away. We did our best, but it was too late. And I did use the homeopathic medicines. So all my career and all my life, I have felt very honest and transparent. And I know a lot of my colleagues might have taken those medicines, thrown them aside, not bothered to give them. And I was a little nervous giving them, but I figured, okay, well, I don't know what they are. And if they don't cause any harm, why not? And they probably weren't the right homeopathic medicine, for this particular cat, sadly. But she should have had the guidance of a homeopath such as myself now, but I certainly was not that then. So it was the first introduction. And later on, I did take Dr. Richard Pitcairn's professional veterinary homeopathy course. So I have been doing the practice of homeopathic medicine since the early 1990s, around 1993. And somewhere in that neighborhood anyway, 93, 94, I can't remember exactly. I did the acupuncture course first because a friend of mine introduced me to that. And I thought, oh, this must be it. And the reason that I started looking into these things is a lot of what clients are complaining about. I would see ear infections, allergy cases, and I would treat them just the way I was told in veterinary school. And many of them would seem to get better until whatever wore off, and then it came back again with a vengeance. And then we would ask them to come in again. So one thing I want to say in favor of my colleagues, don't get mad at your allopathic veterinarian when they make you come in. The drugs they're using are potentially dangerous, even if they don't say they are. And it is important to have a proper look to decide, should I use the same medication again? Should I change medications, or is there something else I can do? Now, allopathic medicine is very limited, and I think I began to get that memo very early on in my career. And I have always been a questioning person. So I want to understand, if I'm seeing the same problems over and over again in the same patient, it can't be about the fact that the client just didn't use the ear medication. They skipped 1 or 2 doses. I just thought that was ridiculous. And, well, so what if they gave it once a day instead of twice a day? We should be seeing some kind of profound difference if I'm doing the right thing. So I felt that, what am I missing here? And the clients would come in and get angry with me. Well, I gave that medicine you told me to give, and now we've got the bloody ear infection again. And I'm sick and tired of spending money on the same problem over and over again. Why aren't you fixing it? And I had no answer for that. I was doing what I was taught in veterinary school, and I believe I was doing it well. But again, allopathic medicine doesn't cure. It's only going to treat and Band-Aid the problem. And when I discovered that going through holistic teachings, I knew I had found the new home. What I didn't realize was just how unpopular I would become with my colleagues. And that's another thing that's very difficult for us as especially homeopathic veterinarians, because we are considered second-class citizens to our colleagues, unless it's another homeopathic veterinarian, and we're a bigger target for the veterinary boards. And this is something that shouldn't be, but since veterinarians are on the bandwagon wanting to squash us out of existence, and clients get upset, as they would with anything, at times they'll have fuel to the fire if they go to an allopathic vet and say, well, this is ridiculous. We should have been using steroids and antibiotics. Well, guess what? Why did they come to me in the first place? Because they didn't want steroids and antibiotics. So they either have changed their mind, and now they're mad that they changed their mind and they want to fuel at somebody. I don't know, but we get to be bigger targets. That is a hard badge to wear, because our commitment, and I believe allopathic veterinarians' commitments, are to do our very best for clients and the pets that we're treating. I didn't get into this for the money, because I'm certainly not rolling in it. I'd love to say that I was. And I do it because I absolutely love it. And now that I actually can procure cures, or at least move animals in a curative direction, or relieve substantial suffering in ways that I couldn't do safely with allopathic medicine, I sleep better at night, and I feel much better about what I do. And I can continue to be transparent to clients and be able to answer those questions of why your pet isn't getting better. And now I know exactly why, taking the homeopathic course with Dr. Richard Pitcairn, and I went on to study with some other human homeopaths as well over the course of the years. And honestly, if we're a good veterinarian, we never stop learning. So I'm always looking for the next good adventure, or the next way to learn my craft better.
Yeah. It's interesting that you bring up ear infections, because my experience has been it's the number reason that pets go to the veterinarian. I also think it's the number one reason why veterinarians lose clients, because those ear infections aren't getting cured. And I just got a call from a client of mine, and I've been trying to talk to him about changing the way he's doing things for this poor dog's chronic ear infections. And he said he finally went home and sat down and looked up how much money he has been spending year after year after year just on the ear infections alone, and he's had it. And he's like you said, he's mad at his veterinarian, which it isn't the veterinarian's fault that he doesn't know better, but he's going to find someone to help him. And so it's unfortunate that veterinarians attack the homeopathic or the holistic veterinarian when they should be wanting to learn from them, because they're losing.
I said to her, you're absolutely right. If I know a better way to do something, and I always share with my clients too, understand this is a developing curve of learning. And, 5 years from now, I might be making some different suggestions about diet, and I am actually, than I was 5 years ago. So, the dynamic change is important as we learn more and we learn how we could do things better. I hate to say it, but most of my allopathic colleagues are stuck in the allopathic paradigm, which doesn't change. It's a new antibiotic, or it isn't, or it's a revamp of another one, or, you know, a renewal of a whatever one, or here's another immunosuppressant.
It's always a new one.
Yeah.
It's always, Apoquil now doesn't work, so now we've got Cytopoint. It goes on and on. What's the next new drug that you can do?
To your point of the chronic ear infections, I actually heard a colleague once tell somebody that the reason that this particular dog had, you know, cauliflower growths in the ears and the ear canals were swollen shut and now they needed surgery was because they failed to treat the ear infections with the proper drugs. And I've got news for you. I mean, I have treated many, many chronic ear infections as an allopathic veterinarian, and I got as many cauliflower ears and swollen shut canals with all the terrible drugs we used. So the more we use those drugs, veterinary-induced diseases such as deafness, because many of the ear drug medications are actually ototoxic, which means toxic to the ear canals, the structures of the inner ear. So we cause deafness, and we cause more intractable and difficult ear infections when we favor more potent, more dangerous, and more lethal, although ear infections usually aren't lethal, bacterial infections in the ear. And so that's an example of veterinary-induced diseases, as well as the use of Apoquil and Cytopoint. They are carcinogens, and which means they are cancer-causing. And while you might be delighted that your dog or cat isn't scratching anymore, you know, buckle up, because down the road, you're going to have immunosuppressive diseases. You cannot use immunosuppressive drugs and expect that the immune system is going to be able to function in an integrative and normal manner. And cancer, by definition, is abnormal cell growth that your body did not recognize, and it organized and aggregated into a tumor. And then metastatic disease is even worse because the body doesn't even recognize the spread of cancer. So when we're using drugs that cause cancer, it's clearly a veterinary-induced disease, and it's peddled by the pharmaceutical companies telling veterinarians. For example, when I was, I used to do part-time relief work in veterinary practices, and the veterinarian that I worked with was an amazing, he was an amazing businessman. I wouldn't say he was the best of veterinarians. He was a steroid guy, so he'd probably get the kind of the feel for where I'd go with that. And I'll remember, you know, we would sit down in meetings and they'd introduce a new drug, like, you know, back then it was Advantage and Frontline and Sentinel, these big new fancy schmancy drugs. And they were going to take care of fleas and ticks like nothing else. And so I said, well, are they safe? And the representative, this is a rep that's not a vet. They're not a scientist. They're just paid to peddle the medications, and they're just given limited information about the medications. Not only are they not studied for very long, but the populace of animals that are used is a small population over a short period of time. And basically what I was told by the representatives, well, they say that the pharmaceutical company says it's safe. So when clients would ask me about it, now you have to understand, this guy that I was working for wasn't my practice. So here I am practicing in his practice, and he wanted to peddle and push as much as possible and sell as much stuff as possible. He was kind of one of those. And, you know, people would ask me, well, is Sentinel safe? And I said, well, I don't know. You know, the manufacturer says it is, but I honestly don't know. And they say, oh, thank you very much. You know, and then they march out and not buy the drug medication. This is before I was a homeopath. So, you know, we're really getting sold a bill of goods, and the veterinarians are peddling medications that I'm not entirely sure that they understand the pure and complete impacts of. And then you have a few veterinarians that will defend those medications as if they were their own, you know, brainchild. I don't understand that exactly, but I for one, I wouldn't want to be selling a medication that could potentially cause a serious illness and portray it as safe. Because I tell you, those pharmaceutical companies are throwing veterinarians under the bus. Because I promise you that they're going to have inserts in those medications that basically say that, well, if the veterinarian deems that it's an appropriate medication, then they should prescribe it. So they're just going to wash their hands of any legal issues whatsoever with regard to any negative consequences that clients have out there.
Absolutely. And they do. The drug reps used to come in and buy us pizza and tell us,
oh, yeah,
you know, what was. And I didn't know. I got free pizza, so I was like, okay, here you go. And so that's how it was done.
Yeah.
And the drug rep was the expert on the drug, which when you think about it now, or I think about it now as an adult, because I was so young back then, oh my gosh, well, it just isn't, it's not right. But it's interesting. So let's go back to some of the illnesses. And we talked about ear infection, and I have, when dogs come to me and they get checked in, I have to get a hold of their records. I need to know what vaccinations they've had. And so I know a lot about these little puppies that are standing in front of me for their first time of coming in for daycare or grooming or boarding. And I can look at those records and I know where this dog's future is going based on those records. And I can tell which dogs will have an ear infection within 6 to 8 months. I know it's coming. I can tell. And so when we talk about that, as far as ear infections being veterinarian induced illness, what other things? So I absolutely believe ear infections are caused by the beginnings of too much antibiotics, too much poor diets, too much of everything that we're just piling on these poor animals, and then their gut microbiomes get destroyed, which we've talked about on the show before about how important the gut microbiome is. But why is it so hard for people to realize that disease takes so much time to happen? So we live in a world where people want everything to be an instant gratification and also instant reaction to something. But an ear infection, if an antibiotic is given to a puppy for, I don't know, let's talk about metronidazole, for example, like comes in and has a little bit of diarrhea, gives metronidazole. Why do you think something like that could later come out as being a choice a veterinarian shouldn't have made necessarily?
Well, I mean, even available via the pharmaceutical companies, there are some other medications like Endazorb, which are, kind of Mortmarilla clay-based products and, have a little bit of anti-diarrheal. Those are pretty innocuous. They don't really cause much harm. And it seems as if, and I'm not sure why, that veterinarians have a tendency to reach for the big guns, right away, even with these tender little puppies. And when we damage the microbiome, you're set up. I'm seeing more intractable cases of diarrhea, chronic diarrhea. I recently treated a dog, for example, that I'm certain was vaccine-induced disease, which is another veterinary-induced disease. And so the microbiome is so damaged, which can be by vaccination or antibiotics, or steroids for that matter, or Apoquil or Cytopoint. Choose your medication. And when we see this, it begins this enormous cascade where the body just can't cope. And the case that I treated, this puppy had, I'm not kidding you, diarrhea for 8 months. And this puppy was 8 months old for 8 solid months. And I probably about 4 or 5 rounds of metronidazole or Flagyl, and never really helped. Maybe some prescription diets along the way. And I changed the diet to whole foods diet, treated homeopathically, and I think it was probably within 1 month, her puppy finally rarely had diarrhea, if at all. And now I think we're about 4 or 5 months out, and there's not been a single bout of diarrhea. And so for 8 solid months, she's begging for help with this puppy.
Yeah.
And if we're talking about ear infections, I agree with you. I think that's a very diet-driven problem. Also, the use of antibiotics and the use of vaccinations. Because again, when we disrupt the flora, you actually have normal flora in the ear. There should be a balance of a little bit of bacteria, a little bit of yeast. And when we use an antibiotic and kill off all the bacteria, then the yeast flourishes, and vice versa if we use an antifungal. So we're chasing round and round and round, and really it's not about the bug in the ear. It's about what is out of balance in the animal system that needs to be corrected and balanced. And a basic foundational thing that must be done is looking at the diet. How can we heal the diet, the gut? How can we favor the strength and health of the patient, whether it's allergies or ear infections, which again, allergies. And I'm with you on that. I know if I get a dog that comes in, for example, and the client tells me that their pet was treated for demodectic mange, and I'm talking about with allopathic medication, I know that the majority or almost 100% of those dogs are going to have skin allergies later in life. I can wildly predict it. Another one I can wildly predict is blocked cats. I can wildly predict that treating them with antibiotics and crappy prescription diets and whatnot, I know I'm going to see those cats in chronic renal failure. It's just a matter of time. And it's almost a complete prediction. And I'm not a psychic. I assure you I'm not. But when we see these cases progress like this over a period of time, then it's disturbing to know that that's where we're going. And can I stop that runaway train in time or not? And the question is maybe not. So, and especially if they continue to get vaccinated, et cetera, which again, blocked cats, UTIs and crystals and things like that, and cats with urinary tract infections are very much driven by diet and vaccination. So, and again, veterinary induced disease. So if we're dealing with that, how do we unwind those things so that we don't go on to get kidney failure later in life? And if we're using Apoquel, can we unwind that clock so that we can unwind a greater possibility of cancer coming down the pike? And the answer is sometimes yes and sometimes no, depending on the length of time they've been on veterinary-induced drugs. And there almost isn't a drug that I can't think of that isn't going to cause a problem.
I know. Isn't that the sad part about it? That's why it's frustrating for me, even though I'm not a veterinarian. I see these, I see 60 dogs a day, and 90%, if not higher, have, unless they're young and just haven't had time to be destroyed by it. But I see so many of these animals that are having these problems. It is so frustrating. And that's why I send my listeners to veterinarians like you and some of the other veterinarians I've been fortunate enough to talk to, because I'm trying to stop that train. I know where it's going to happen, but people don't really understand when I'm telling them, listen, I'm looking at your record and I see possible problems in your future. I would love for you to speak with somebody who can maybe stop this from happening. But unless they are given the vaccine and the dog goes into a seizure right then and there, they really are having a hard time understanding what that will actually cause later on in the dog or the cat. It's very frustrating and sad.
I don't know if most people watched the documentary and I'm not going to remember the name of it exactly, but it's about the young gentleman who actually was a vegan. And he did an experiment on himself by eating McDonald's 3 meals a day, nothing but McDonald's. Mm-hmm. And anything that crossed his lips was McDonald's. That was it. And I think it only took like a couple of weeks in his particular case to start to see changes, not only in his body, but also in his energy level and even his blood values. And at some point in the pike, and I don't know if it was close to a year, his doctors were begging him to please stop that experiment because he was killing his liver and kidneys. When we think about the cumulative effects of what we're doing as veterinarians, it's not very different than that example of that documentary. It wasn't as if he ate his first meal of McDonald's and he was immediately seriously sick. Now, we saw him throwing up and vomiting as he progressed, continuing to do that abusive diet over that period of time. But it didn't necessarily happen after his first meal of McDonald's. And it's the other thing I think that's a little bit difficult for people to kind of, oh, well, I don't eat McDonald's, but once in a while. That's fine. Some people can smoke cigarettes for, 20, 30, 50, 90 years and have not a lot of effects, but the majority of individuals will have negative effects. It's not if, it's when. And that's what we're going to be dealing with. So I understand that the immediate effects, like if we give a vaccination and they have an immediate anaphylactic reaction, everybody recognizes that. And, I treated a sad case one time where this 14-year-old cat got all of the vaccinations that this poor indoor cat certainly didn't need. And within 2 hours, developed fluid buildup outside of the lung cavity, compressing on the lungs and causing her cat not to be able to breathe. And the veterinarian clearly and succinctly said there's no way that the vaccinations could have done that to your cat. It was too quick. And she said to me, well, what do you think? And I said, well, there's no question about it. You went in, there was no fluid. your vet listened to the lungs and said they sounded fine and vaccinated your cat. And then now your cat is filling up with fluid and suffocating. I'm sorry, but you can't tell me that the vaccination, if it didn't cause it, it was the tipping point of the accumulation of all of the illness that has occurred over time that the animal has been compensating for. And remember, too, that some of the animals that we deal with are, they may be hunters, but they don't survive in the wild if they're showing gross illness. They'll get plucked off, they'll get picked off by their predators in a minute. And especially birds, I treat birds too. If you think about birds, I mean, they're very delicate and they're very preyed upon. If they showed that they were weak or lethargic, or that's it, they'd be the first picked off, out of the bunch. So animals have an amazing ability to try their best to adapt, and even some people too, but to adapt to their illnesses to a point that people get used to a new norm of their dog being a little stiffer, a little less active, and it comes on so slowly and insidiously that they don't quite realize that their dog is actually beginning the spiral of deterioration. And what's even more egregious in my profession is I have so many clients that come into me to tell me that their allopathic veterinarian said, well, your dog is 8 years old. They're a senior. They're old. And I was like, really? 8? That's, for a Labrador, that's like middle age. I mean, that's not old.
Yeah.
Well, when we adjust our expectations down and lie about animals living longer, if they live longer, they're not living longer and better. They're living longer and senile, or longer and crippled, or longer and sicker and more tired and more lethargic. And that's such how it should be.
Yeah, no, your point on that is just, I can't tell you how many times I hear people tell me, well, my dog, now keep in mind, I see a lot of these dogs, and I'm not trying to call out any of my clients, but I have had a lot of people say, well, I had a dog live to be 15 years old, and he lived to be, he was 15 years old, and I think back on that dog's 15 years of his life because I know him, and I've been around a long time. I've had my business for 21 years, and what I see is a dog who was overweight, who had diabetes, who had chronic ear infections, hot spots all the time. And I think how sad that all you did was put a time on it and not a quality of his life. And then to use that as an argument for why it's okay to feed McDonald's, so to speak, and to continue on that path is just, it's horrific. But on another note, I do think that we shouldn't say 8 years old is senior. That bothers me.
And, people will say to me, well, the life expectancy of my Great Dane is only going to be 7 or 8 years old anyway. And I said, well, why is that the case? I mean, we know that Great Danes can live well into their teens. So why shouldn't they? And the reason that they don't is because we're over vaccinating, we're medicating diseases away, which aren't really medicating them away, or we're driving the diseases deeper to more vital diseases like diabetes and cancers and organ failures and, you name it. And these animals are living not good quality of life. And I just find it as a veterinarian unacceptable. And when I went to veterinary school, I thought I did that because I wanted to come out. I wanted to help animals, and I wanted to see them truly heal. I wanted them to have vital, healthy lives for a long time and to be able to be with their people, for a long time. Not, oh gosh, we made it to 9. Wasn't that great? And then, Beefy got cancer or something like that. And I know when we spoke one time, recently on Joey's Legacy, I had referred to a veterinary-induced disease that to me is just simply heartbreaking. And not only veterinary-induced disease, but then, in my opinion, bad veterinary decision-making. And this is a little dog that's just a little miniature poodle, and he's really not very old. And this little dog means everything, to his person. And this little dog had got a mast cell tumor. And I was looking through all of the records, and I thought, okay, well, let me see what the story is, because I always ask for all of the medical records and all the test results as far back as anyone's had their pet for, because I haven't worked with them from, 0 to now. And I want to know, well, what are the trends, and where are the areas of weaknesses, and what kind of medications have they had, and, what responses to those, etc. And this little dog, I just couldn't find anything except that they did sign up for lifetime vaccinations. So I don't know what that is, a one-time fee or something. So the little dog developed mast cell cancer, which I'm going to propose to you and your listeners that I believe that's purely a vaccine-induced cancer, along with lymphoma and hemangiosarcoma. All of these are immune system cells or blood-borne cells, etc. And I think that they are keenly tied to vaccinations and fibrosarcomas in cats, which we know about as well. That's the injection site sarcomas that cats get. And we know that for a fact that that's vaccine-induced disease. So
yeah, that's been proven.
It has been proven. I think eventually we're going to prove some other things. I mean, the rabies vaccine can be tied to cruciate ligament tears, strains, weaknesses of the cruciate, and also some degenerative spinal diseases. But anyway, so that aside, this poor little dog had the tumor removed. Not necessarily the greatest of ideas, but I get it. And the tumor was removed, and they proceeded along to go right ahead and vaccinate this little dog again. Now, he had healed up and seemed to be cancer-free. And then within a month of the booster vaccinations that he clearly didn't need, that were in the free plan, he had a recurrence of the mast cell cancer. And now it's inoperable. It's too invaded and invasive, and so they're not able to operate it on. So I'm working on this little dog. We'll have to see how that goes. But it was heartbreaking because, I thought not only is this vaccine-induced disease, but then he has cancer, and then you're going to vaccinate a dog that has cancer. Even if you don't want to argue it's not vaccine-induced, which I believe it is, it doesn't really matter. Vaccines should be used in healthy animals only, period.
Right.
I don't know about you, but I would not call a dog with cancer healthy, even if they're bouncing around, chasing balls, playing with their people. I wouldn't call that healthy if you have cancer. And it's another thing I think that clients get confused about. Their pet may have a history of cancer, like mast cell cancer or something like that, get treated or a tumor removed, still running around and playing. And they'll come in and say to me, well, my pet is perfectly healthy except for the cancer on his or her leg. Or my dog is perfectly healthy except for the cancer of the spleen. And, I'm thinking, okay, well, I want to break that gently because I don't want to offend anybody, but the definition of cancer is definitely not healthy. So we have to address that, of course. But when it's veterinary induced and we're making poor choices, that's not helpful to the animal. And I cannot tell you how many people spend thousands and thousands and thousands of dollars chasing veterinary induced diseases. And again, I don't feel that the veterinarians are maliciously doing this, but a little bit of common sense would be a good idea. And even to pay attention to the vaccine inserts if you don't necessarily believe that, a dog is healthy, even though they had cancer. You should never use a vaccination. If an animal has a chronic disease of any kind, a recurrent disease of any kind, or a history thereof, you can induce that disease again or make it worse by continuing to vaccinate. It's just unconscionable to me. And there are a lot of vets that won't vaccinate a dog with a history of cancer. They'll stop vaccinating at that point. Maybe not quite soon enough, but that's okay. At least they stopped at some point. And some just don't. I don't know why.
Yeah. I'm always shocked at my dogs that are what I consider ill. And I may go a lot further than some people, because to me, an ear infection means your dog isn't healthy. And
I completely agree. No, they should.
If your dog, but the definition of healthy apparently is not the same for me as it is to most people. And I see it all the time where they'll give a vaccination to a dog with an ear infection, and then within 2 weeks, the dog has got other issues. Now all this other stuff starts happening, and nobody can quite understand why. I know why, because you vaccinated an unhealthy.
Yeah. Any animal
But
that
it's
has
difficult.
anything that is out of balance or out of character, any symptom present, is not well enough to be vaccinated. And however you wish to go about treating that, you should never consider resuming vaccination until or unless they are healthy enough to receive a vaccination. Most dogs that are epileptic or have chronic recurrent ear infections probably are never really going to be healthy enough to get vaccinated, or inflammatory bowel disease, or history of cancers. They're not going to be healthy enough to vaccinate again, period. And if we aren't the advocates for our own pets, then you just may get caught up in that web of your dog getting vaccinated and watching things begin to unravel every which way around in their systems.
Yeah.
Because there's only so much they can tolerate. And I think it's important to mention that we have known since the early 1970s from Dr. Ron Schultz that there has never been any study that has suggested that annual vaccination is efficacious, medically necessary, or in any way helpful for any animal. In fact, we know if I do booster vaccinations for an animal that has antibodies or antibody level already, it's sort of like having more sex and getting more pregnant. We will never produce more immunity in an animal that already is immune to the disease we vaccinated for. And we don't get childhood shots every year. I mean, I wish I hadn't gotten childhood shots personally, but my mother only knew what she knew, and that's what she believed in, so that's how it went for me. So we can make different choices, and sometimes we need to stand up to our veterinarian. And if we find that we can't dialogue with our veterinarian, don't take it too personally. I mean, maybe that's just not the vet for you. Find somebody else who's willing to dialogue with you and is willing to contemplate different ideas. Because if we're not willing to do that, we're not going to be a partner in health together. We're just going to be my way or the highway. Take the highway. I mean, just do. Because the minute that we are rigid and have no flexibility in something that makes either common sense or good medical sense, I'd be running away. Even if you've had that veterinarian for a million years and they've always been so nice and kind, and there's a lot of good people out there that just don't get it, or they don't want to get it, and you're not going to make them get it. You can lead a horse to water, but you can't make them drink. So if your veterinarian doesn't get it and your veterinarian is not willing to partner with you, I encourage you to find one, whether it's allopathic or homeopathic. Hopefully you'll seek out a homeopathic vet. But even if you don't, find somebody who will work with you for the well care of your pet. This should be about well care, not disease care. We have a disease care in this system. In our medical system, we have a disease care system, and the same is true of veterinary medicine. This should be a well care system. And well care doesn't mean annual dental month. Let's see how many dentals we can get done in 1 month. A little staining on the teeth. Let's put them under anesthesia for a dental. That is just scary. Anesthesia is a serious procedure. It's not like us sitting in the dental chair where we can just acquiesce and agree to have the ultrasonic scaler go all around our mouth. It's not like that. And for dogs, they have to go in under general anesthesia. This is not light sedation, which is still anesthesia, by the way. So we need to be thinking about these things. They don't need to go under anesthesia for a dental cleaning unless they have a very painful mouth with an abscessed tooth that's just not going to come out or fall out on their own. It's interfering with their eating. Then maybe they need an anesthetic dental cleaning, but not to give them some pearly white teeth. There are dietary measures, homeopathic treatments, supplements that could all help with those kinds of ailments. And that's an underlying
That's real well. That's the difference between when you say well care is preventing the plaque and tartar to build up on the teeth, not having you come in once a month to have or every 6 months or every year. I know there's some hygienists that work with veterinarians. I have a veterinarian that comes in and with a hygienist, and they do the non-anesthesia teeth cleaning.
Yes.
But they don't, there's a lot of them in my area that recommend it every month. And then they give you this discount to clean the teeth. And we talked about it, the veterinarian and I and the hygienist. And I said, I don't know, all that scaling on their teeth doesn't seem, they have enamel also to be scraping constantly. And so we won't do that. But I think more importantly is discussing diet nutrition supplements that can help.
Well,
And that's what we
the entire digestive system starts in the mouth. So you have microbiome in your mouth. The dog does, cat does. And if your gastrointestinal system is upset, that could start at the mouth. It could start at the esophagus, the swallowing tube, the stomach, intestines, colon, rectum, anywhere. That's all part of the digestive system. So scaling the teeth, cleaning the teeth, doing a hand scaling. I do hand scalings also. And no, I don't do them every month. And no, I don't recommend them every month. And we will damage the enamel. That's absolutely accurate.
Yeah.
If we don't address the underlying issue, it's another good example of the underlying issue. That's an underlying issue of chronic disease. What that means is the body is out of balance, whether it's the oral cavity itself or the entire gastrointestinal system. If we don't address that, we will never fix the tartar buildup, the inflamed gums, the overgrowth of gum tissue, although that comes from over-vaccination, those growths that occur on the gums. And they know they don't have to be removed or, cut out of the mouth or whatever. So we need to get to the underlying causes, and that's not something that is true well care versus allopathic medicine where we'll just get you in every 6 months or a year for a dental cleaning. It doesn't fix anything.
Right.
It'll clean the teeth off, and I've known dogs that will actually get a disgusting mouth within a month after a dental cleaning. And why? Because we didn't fix the oral cavity. We just cleaned the tartar off and rinsed everything out and sanitized the mouth a little bit for 5 minutes, and then it's back to the same chronic disease you came in with.
Same thing.
And you just paid a lot of money for that dental. Furthermore, sometimes that is an opening for something terrible to happen to your pet afterwards. Diabetes, cancers. I've seen, for some odd reason, after anesthetic dental cleanings, I've seen animals completely decompensate with diseases we weren't quite aware that they had prior to the dental. And then they're in dire crisis, or we just plain out lose them. And, we need to take anesthesia seriously, but more importantly, we need to focus on true well care. The only way we do that is through the underlying causes. Homeopathy treats that the best. That's individually working the cases up. And it isn't about getting the dental cleaning or getting that little chlorhexidine, little pod stuck, in the gum or whatever. Well, that'll just antiseptic the mouth a little bit longer. That's about it. And then you're back to square one where you had the imbalance of flora in the mouth and through the gut system. So we have to address that. And diet is important too. So I don't want to minimize that because that's super important as well. And most of these people poor diet, and they go right back onto the poor diet that they were on that brought them in for the dental cleaning to begin with.
It's frustrating.
Yeah.
Let's talk about, I know we mentioned a couple of veterinarian induced diseases. We talked about ear infections, IBD, cancers. What about stuff like diabetes or Cushing's disease? Do you think these are veterinarian induced?
Many of them are. I'm not saying that there may not be some genetic components, but there are several things to think about, even if you have a genetic potential component. If we continue to do things that are not well care and not supportive of the body, like continuing to over-vaccinate, feed poor diets, use a lot of drug medication in the body, then you're going to advantage that genetic disposition toward getting Cushing's disease. We know that Cushing's disease, there's such a disease called iatrogenic Cushings. And iatrogenic is a very fancy word that admits that is veterinary induced Cushing's disease. And where that might come from, and that's what iatrogenic means, is that guess what? We caused it, or the medications we're using caused it. Same thing, really. If we use steroids over and over and over again for allergic skin problems, et cetera, we could cause diabetes or Cushing's disease in that individual patient. And it is recognized in the veterinary world that we could cause iatrogenic Cushing's disease. I've seen that word drop away, as of the past, I don't know if it's been 10 years or so. I don't hear it very much anymore. So I'm not so sure that veterinarians want to admit this veterinary-induced phenomena. But over-vaccination damages the gut microbiome. It also can cause leaky gut syndrome, antigenic release toward your own organ systems to destroy any of your organs. That could be heart, liver, kidneys, pancreas. And the pancreas is an incredibly delicate organ. So if we damage the pancreas through leaky gut or through any particular medications, like steroids can definitely irritate the pancreas and cause pancreatitis. It's one of the causes of pancreatitis. So if we're using medications like that or vaccinations, we could induce permanent diabetes. If you're lucky, maybe it's transient, meaning that they'll be diabetic for a little while and then maybe they'll correct. Most of the time they don't. But again, I've reversed some of those with homeopathic treatment. And most of the drugs that are used for these veterinary-induced diseases, which I do believe that Cushing's disease and diabetes is largely veterinary-induced, even if there's a genetic predisposition. And while we could argue the veterinarians may not know there's a genetic predisposition in any particular animal because they don't really track it like they do in people. Did your grandmother have it? Or most breeders aren't going to really want to admit that their dogs were diabetic or something like that in the lineage or the line, or the responsible ones won't breed those. But even if we don't know, we still could do no harm. And when I graduated from veterinary school, we took an oath that said, above all, do no harm. And I found as an allopathic veterinarian that I did a lot more harm than I did good. And I didn't feel good about that. It didn't feel right to me. I didn't like that the animals seemed more lethargic, or that they could get vertigo or balance problems from the use of drugs for the ear infections. I didn't like that animals could get neurologic disease from metronidazole or flagyl. I don't know if you know that's a side effect, potential side effect of flagyl. And I want to clarify, too, the correct name for side effects are the disease the drug causes to your animal. That is, side effect is a polite term, but really it is the disease caused by the drug itself. And so now you have the original disease and you just layered on to the original disease a drug disease in addition to that. And those are veterinary-induced diseases. So veterinary-induced diseases come in a plethora of forms, unfortunately. And again, you end up paying for that over and over and over again. So I treat a lot of Cushing's disease patients, a lot of diabetics. Some of them cannot come off of their medications. I'm talking about the diabetics. Most of the drugs for Cushing's disease is worse than the disease itself. So there's a lot of help that these animals can get through proper nutrition advice, as well as homeopathic treatment and proper supplementation. And many of them, we can reduce the dosage of the insulin to a much lower level. And you don't have to do as many glucose curves and things like that, and crises in the hospital, et cetera, where people are having crashes and having to, recalibrate the insulin for these diabetic dogs, et cetera. But when we're talking about having ill effect on the immune system through vaccination, damaging the gut microbiome through vaccination, there is a myriad of diseases that we can cause. And it's a sad fact, and some of them are transient and some of them are not. And, I don't want you to go out and go scream at your veterinarian. Remember what I said earlier, that if they don't know another way to treat, because that's not the dominant paradigm in veterinary school, we can't expect them to know that. But we can ask them to be open-minded and do things differently, in the sense that, okay, my dog is diabetic, let's not continue to vaccinate. My dog has Cushing's, let's not continue to vaccinate. Could you support me in a home-cooked diet or a home-cooked food versus the commercial diets? And then I'll make a joke about all the prescription diets. If their diets were so bloody good, why did they have to make prescription foods? If their foods are great, the animals should be so healthy on them that you would never have to make prescription foods in the same company, right?
Love your take on that. I hadn't heard that before. Yeah, exactly. If they're so great, why did we have to go into prescription diets?
Why do we need, hyperthyroid diets for hyperthyroid cats and diabetic diets for diabetic dogs? I mean, why do they have diabetes? If the food is so great, they shouldn't have diabetes.
They shouldn't, exactly.
Yeah, they should need one.
So when we're talking about, a lot comes down to the vaccinations, which I understand, and I'm with you on that's a big part of what's causing these diseases. For our listeners, if, they're sitting there and they're like, well, okay, I've already given the vaccines, it's done, and my dog seems to be healthy by my account. He's eating, drinking, whatever, doesn't seem to be unhealthy. You and I agree that doesn't mean that along the ways we're going to start to see these things pop up. So what can one of our listeners do if they want to stop that train? It's already in motion. Is there something they can do either holistically aside from not doing it anymore? Of course, that's what we're going to be an advocate.
Well, that's a very first big step. I would seek out a homeopathic veterinarian that is willing to talk to you about proper well care. And I'm sorry to say that not all of my homeopathic colleagues will focus in a big way on nutrition. And not to say that they don't advocate healthier foods, home cooked food and things of that nature. But there's a lot we can do in terms of even using food as medicine, food as healing. And I do macrobiotic eating, which is a type of healing food eating. And I do that a little bit with some of my patients also. So if we can get creative in that vein, we can start to help clean the system out as best we can. And then working with a homeopath, if there are any clinical symptoms, and trust me, our search for clinical symptoms is definitely more detailed than a traditional allopathic veterinarian. So if you think, okay, well, my pet is healthy, but they have dandruff. Well, that's a symptom. If they have dandruff, it's not a serious one. It's not a life-threatening one. It's not one that might rush you into the veterinary office, but there may be, and I'm not saying I prescribe only on dandruff, don't get me wrong, but there are maybe other things there. Maybe they throw up periodically. A good example are cats that throw up hairballs. People are taught that cats that throw up hairballs all the time is just normal. It's not. Cats should maybe throw up a hairball once or twice a year. And it's unreasonable that veterinarians will say, oh, well, it's just your cat that does that eats fur balls off the floor and, chews paper and ingests paper and plastic and, paper clips and, oh, what a silly dog, or, whoa, what a silly cat that goes and does that. These are not average, and I don't like to use the word normal, but these are not average symptoms or behaviors in any way. So I would seek out a homeopathic veterinarian to start a well care program. If you go to an integrative vet, they're not bad vets, but they are allopathic veterinarians who are practicing some holistic modalities. So you're going to get primarily allopathic medicine again, and you're going to get allopathic brain thinking, and they may be more amenable to maybe not vaccinating as much or maybe not vaccinating at all, but you'll still get allopathic treatment first, and then maybe a little bit of ancillary holistic treatments along the way. And it's not the same well care. I'm not sure that I would quite call that well care, to be honest with you. It's a better attempt and kind of a better place to go. And even though there's few homeopaths in the United States, seek one out anyway. Maybe someone's willing to consult and give you some advice over the telephone. Some of us do telephone consultations. And it's a good idea to consider something like that because we are going to reach more deeply into proactively helping with well care. That said, it doesn't mean I cure every patient I come in contact with. I wish I could. I would love to. It's not, humanly possible. But do your best to educate yourself, to seek out a homeopathic veterinarian, to really look for a different pathway to health, and avoiding those things many of the things that we've already discussed, that's going to promote more diseases in your pet instead of creating a healthier pet. And understand that just because clients will come in and say, well, I don't know why my dog has cancer. I haven't done vaccines since they were 2 years old. Remember what I said about cigarette smoking, or the gentleman that ate McDonald's 3 meals. Some individuals might have been able to go longer than he did and not have any marked symptoms of disease from eating that food. And so even though we stopped vaccinating at 2 or 3 years old, let's say that a client decided to do that, doesn't give you a free pass that there will never be a negative consequence down the road. So I'm proactive in my well care. If there are symptoms to treat, I'm going to treat. I'm going to hope that that's going to help to move that patient to the highest level of homeostasis and balance that they can achieve, and try to keep them at that level the best that we can, especially with balanced, good nutrition of whole foods, not junk in a bag, not junk in a can, not prescription food, etc., but real wholesome food, as we should be eating real wholesome food and not hungry man dinners. Because if you think you're going to be healthy that way, just watch the documentary of the gentleman eating McDonald's.
Yeah. I still hear to this day people, when I say, what is your pet eating? And they say, I never give him people food. And they're very proud to say that. And they're always very shocked when I say, well, that's unfortunate. Because if you understand how to create a diet and your pet should be eating, it's just food. It's not people food. It's not dog food. It's food. And so it's just food. It's how
I will say that the clients that come in to see me, they sheepishly will say, well, sometimes I'll sneak, some people food. And I said, that's fantastic. And they are like, oh my gosh. Oh, I'm so glad I'm here. The shaming that we as veterinarians have done as if people food is the most poisonous thing on the planet. Now, I will say, I'll tell my clients, please don't share your pretzels, your ice cream, your potato chips, your popcorn. I mean, let's be honest, it's just empty calories and junk. So there's no nutritional value in these things. So within reason, if you're feeding nutritionally valuable food, and you will notice, on my website, I don't post on my website a particular diet. It is important to work with your homeopathic veterinarian because you might have a pet that has pancreatitis or is sensitive to rich or fatty foods, which again is a chronic disease that should be treated. And if they do have those things, I don't want to post a diet on my website. So don't be disappointed if you go on my website. I don't want to post a diet, have somebody give a diet that's not appropriate for their pet. So there's no one size fits all. But the general genre I want you to really get here is that whole, real, wholesome, healthy food, not something processed or in a can or whatever. We're just not going to stay healthy, eating hungry man dinners and, frozen meals. And I hate to burst anybody's bubble out there. I know we're a busy society. People are raising children, people are working 2 and 3 jobs. I totally understand that. And I try very hard to work with my individual clients to try to find something. How can we work this so it is workable in your schedule? Because it really can be. I know it's really convenient to pour out, garbage little pellets of dry food into a bowl and call it a day and let your dog eat that or your cat eat that. You'll pay dividends. It's not if, it's when.
It is. And I told you that client of mine just called me and said how much he was spending a month at the veterinarian. And that money could have been used for food and all the inconvenience of going to the veterinarian, the cost to go, the pain for the animal. There's so many reasons.
Time off from work, to go through that. And then the damage caused by all the medications that have been used over a period of time. Again, veterinary induced diseases. And over and over again. Sometimes I have clients look at my website and go, oh my God, look at your hourly rate. And I said, well, okay, you spend about 5 minutes with your veterinarian. You just spent about $50 or $70 for an exam. You had about 2 minutes of the vet. And then you went home with a bunch of medication. And guess what? You got to go back again to treat the urinary tract infection over and over and over again, or the ear infection, or the allergy, skin allergy, or, oh gosh, now my dog has diabetes because I used too many steroids. Or, oh, gee whiz, my dog has cancer now because I've had my pet on Apoquel or Cytopoint. Or Atopica. That's the other, flavor of the day and all of these kind of sprung out to sort of be alternatives to steroids because everybody got the bad buzzword about steroids, but get a bad buzzword about the other ones. Because I got to tell you, I think I'd almost rather see a dog on steroids than on any of those. But honestly, I'd rather see a dog or a cat on neither. None of them, all of the above.
No, it's definitely it's an epidemic, and it's why I wanted to talk about this today with you, because we kind of touch on it a little bit, but I've never really come right out and said that it's veterinarian induced, and you say it in such a wonderful way, in that these are your colleagues, and it is happening, but it's not that they're purposefully doing it. But we do want to seek out these veterinarians that are willing to learn a little bit more, educate, listen to other veterinarians that have been around for a long time, and
listen to clients, because I know when clients come in and explain to me what they're experiencing with their pet, even if an allopathic veterinarian may not understand why that is occurring, I really challenge my colleagues to look critically at the wellness or lack of wellness of the patient before them and make better choices for that animal and for the client.
Yeah.
And even if it might be upsetting for the client, and I understand some clients come in, nope, I just want another round of those antibiotics. They seem to work great last time. Please give me more of those. And yeah, I get it. We're not going to eliminate all of that. I'm not looking to eliminate all of that. I challenge my colleagues to, work a little more outside of the box, do less harm, and certainly pay attention to practicing the highest quality of medicine that they can. And I understand some clients will not agree to some testing and you're left with some limitations. And I understand that. You might give a drug that's going to be ostensibly dangerous for the kidneys. Well, then don't give it. When I worked as an emergency veterinarian, I had I was not their regular veterinarian. They didn't know who I was. They didn't know that they should trust me. I'm just an ER vet that's just trying to take a ton of money from them. And the technicians would go in and do, a whole breakdown of all the things I wanted to do for their pet. And the client would say, nope, decline everything. And then I would go in and just explain why I wanted to do it. It wasn't about packing their bill, but I don't want to use a steroid or an antibiotic. Sometimes I was actually using homeopathy in that ER because she's a wonderful colleague of mine and she's not holistic. But I asked her permission. I said, look, I'm not going to take your practice over as a homeopathic practice or anything, but if I see an indicated case where I think I can give a homeopathic medicine and the client is okay with that, are you okay with that? She said, as long as you help the animals, I'm fine with that. And I cannot tell you how many times people really appreciated that. And it helped the animals. They didn't know what it was. They didn't understand what it was. They didn't care. Their pet got better. And that's all that mattered. But when we're stuck having to prescribe something and we're not sure what's wrong with the pet because we weren't allowed to do diagnostic tests, then we are running down a dangerous path of potentially giving a medication that could be even worse than the possibilities because we don't know. And you cannot expect that veterinarian to know. And so I had the largest turnout of clients that actually appreciated me and would allow me to do the diagnostic test so that I could feel more comfortable, if you could say comfortable, about, prescribing an antibiotic or giving an antibiotic injection or an anti-nausea medication, because I knew that this one I can use because the kidneys are looking fine or the liver looks fine.
Right.
Or, oh gosh, no, I really do have pancreatitis here. We're going to need to treat a little bit of a different way. So, I wanted to let the veterinarians work your pets up, whether it's at the ER or not. If something doesn't seem right to you, question it. Make sure that you're working with a veterinarian on a regular basis that, will listen to you and dialogue with you. Because if you're listening to a podcast like this and you say, gosh, this really opened my eyes to some things, then you're okay to bring those to your veterinarian. And they should be open enough to discuss it with you. And if they're not, pack your bags and find somebody who is.
If they're not, pack your bags. I say it all the time. If they're not open to listening to you, you have to go, and it's okay.
I mean,
I
said to you also about the woman who came in and shoved Dr. Pitcairn's book in my face. I wasn't sure what to do with that, honest to God.
Yeah.
And I'm looking at this moribund cat in front of me. That means like completely collapsed and barely responsive. And I'm thinking, oh my gosh, I want to hurry up and, give like serious supportive care to this kitty. And she's shoving all this stuff at me. And, I still listen to her. And I thought, I don't know about that medicine. That's something she knows I don't know. I don't know how much experience she has in it. Doesn't really matter, but it's something I don't know about. Maybe this could be something helpful. What if I don't give those homeopathic medicines that she has asked me to give? And, and I wasn't able to save her cat because I just denied a medicine because my ego got in the way. Because I said, well, that's crap. And you shouldn't, no, I'm not going to do that. And, and honestly, I guess that was a leap of faith because I knew so little about it. Who knows? Maybe it could have done harm. I know now you can't kill an animal with homeopathy. It just isn't physically possible. Yeah. It's not toxic. It's completely non-toxic. it doesn't have the ability to kill an animal. The worst that can happen is we use the wrong medicine, which isn't wrong by standards. It's what we prescribed that we thought was going to be a good fit, and it doesn't help. And the disease progresses, or the patient is incurable. And no matter what I'm giving, they just can't respond. Those are really sad cases. It's really hard. But then, too, if I have a case that's not responding, I'm going to intervene with a new homeopathic medicine as quickly as possible, just given the case. And again, I'm talking about severity of cases. Certainly, itchy skin doesn't command an emergency that I better change the homeopathic medicine immediately or else. I'm talking about some of the really critical cases. And some of these critical cases really turn around in ways that I never saw in allopathic medicine, just never saw. Cancers, sometimes cancer tumors would regress and go away. Sometimes autoimmune diseases would completely reverse. Animals could come off their, anticonvulsant medications or insulin. And again, not always, but, even so, could we reduce those medications? Can we bring those down to a lower, less toxic level and give more health care, real, true health care to that pet to try to bring their base of homeostasis up high enough that we can actually reduce some of those dosages. So I've just done things in homeopathic medicine. It's not about me. It's about the power of the medicine that I've never been able to do in traditional medicine. And I don't believe I've created any veterinary-induced diseases as a result of that. And I can say that happily and proudly. There is no such thing as that in homeopathy.
That is a great thing to be able to say. And I actually teach, my listeners to, at the end of your pet's life, you want to be able to say, I didn't cause, because we know there's so many other factors out there. Every pet that gets sick, you can have a pet who's never had a vaccine in his whole life, and he can still get sick and things can happen.
Absolutely.
So your pet's life, I think it's really important. And as a veterinarian, I would think it's very important to be able to say, I didn't cause, I did no harm. And that's why I talk a lot about making sure you feed the right foods. You don't over-vaccinate. You don't over-medicate. You don't give flea and tick medications and stuff for convenience instead of for health. Because when you are sitting in your veterinarian's office and you may have to face putting your pet to sleep, you don't want to also be going, oh, I knew it. I shouldn't have done that. You don't want to do that. So.
Well, think of I've had a number of pets that have had the flea and tick medications, and they have twitches and ticks and or grand mal seizures. And, we've got these pharmaceutical induced diseases, but veterinarians are peddling this stuff. Oh, every month, and don't forget, and you have to get, we're scared of the bugs. And there are alternatives that are a lot safer. I want to say, and I think it's maybe one of the most important things I'm going to say this evening, because I've had to say it to myself for pets in my past when I didn't know better. You only know what you know when you know it. So we can't make different decisions unless we're empowered with the knowledge and we ask questions and we use common sense. And so we only know what we know when we know it. I treated a dog with conventionally for heartworm. One of the first dogs I got after getting out of vet school, I didn't know any better. And she ended up kind of losing her mind. She went kind of crazy years later, and I had to put her to sleep at 9 years old. She was a Rottweiler. And, she was a bit edgy to begin with, but suppressing by treating the heartworms with the powerful arsenic-like drug, she was never right after that. She was edgy and she was, prey-driven and looked like she was going to kill my cats. And then eventually she started snapping at me. And, you could see like she just would kind of lose it. It was sort of like, it's akin to a seizure-like activity. And because she just kind of lose her mind. And then she would be, oh my gosh, what did I do? But it got dangerous. And that was heartbreaking. And when I look back on that, it's so upsetting to me because I think, well, gosh, if I'd only known about homeopathy back then.
Yeah.
But you only know what you know when you know it. We absolutely know. And when people come to see me and they regret having, allowing the vet to do all the previous things and whatnot that weren't, in the animal's best interest, they feel guilty and they feel really bad about it. Please don't. You're doing the best that you can with the knowledge you have. When you obtain different knowledge, you can make a different decision. And we need to be
Yeah.
kind to ourselves. I need to be kind to my colleagues because they're trying really hard, but they have limited
Yeah.
tools and their tools don't work and their tools make animals sicker. And it's a fact. I mean, I'm going to have colleagues disagree with me, and that's all right. I was open-minded enough to see it in front of my eyes, question it, say, why is this happening? I'm doing everything that I was taught to do in veterinary school, and the animals don't look healthier. They look sicker. They don't look as well. What's wrong? What am I doing wrong? And, if we don't ask ourselves those critical questions, we can't make other choices and we can't make other changes in our practice. So am I going to do everything perfect and everything right, even as I do it now? No. I'm going to keep learning and hopefully getting better and hopefully, honing my skills so I can help more and more animals over the course of time. But I certainly have helped so many more since the early 90s than I ever did the first few years out of veterinary school. I created a lot of veterinary induced disease out of vet school.
You're helping so many through our, this little podcast that I started like a year and a half ago, 2 years ago. And I'm so happy to have you be part of this team to continue to teach as many listeners as we have. It's just awesome that you're part of this little group. I know I talked to you about having Dr. McCarran on, and we've had quite a few of everybody that's kind of growing in this team. And it's been amazing to be able to help people, educate them so that they don't have to feel that guilt that they feel, because we're going to educate them and help them. So you're so gracious with your time, but how do people contact you if they're listening to this? Because we don't have, like you said it yourself, there are not a lot of homeopathic veterinarians, and you're willing to do consultations. So how would people get a hold of you?
I have a website, so certainly you can go and peruse my website, and it is holisticvetcare.com. And holistic is spelled with a W in the front, so it's WHOLISTIC, vetcare.com. You're also welcome to call my office at 352-796-2648. You also can go to the Academy of Veterinary Homeopathy site and look for a homeopathic veterinarian in your area. Please be aware you may not be able to find one within close proximity to you because there's so few of us. Feel free to ask if they do telephone consults. Please be open to driving an hour or two. I have clients all over the state of Florida. They drive, and I have clients all over the United States. Some of them fly down from New York to see me once a year and drive down from Virginia, Georgia, even California once. So, be aware, be okay with making a travel. If you want to make a change that's really going to make a difference for your animal. And the Academy of Veterinary Homeopathy is www.theavh.org. So please feel free to visit that group because you can search for your state and just see how far away a homeopathic veterinarian might be to you. It's always nice if you can see somebody local to you, but you're welcome to contact me as well, by all means. And I'll be more than happy to help you in any way that I can.
Thank you so much. And we're going to...
Valuable. Thank you for doing this, because if it weren't for you, you wouldn't get, Dr. Richard Pitcairn in front of people. You wouldn't get myself or other, wonderful people in front of, including you, and how you educate your clients and how you make this available. It's a labor of incredible love. I mean, this is not something that, we're making money off of. The important thing is to be helping people. This is a labor of love. And Carrie, I can't tell you how much I appreciate your willingness to do something like this and get this in front of people so that they can, provide this for their loving fur family members.
It's funny how we don't know how. I'm going to get a little cheesy and sentimental for a second, but I always loved animals from little tiny girl. I just loved animals. And I've always worked with them. Started out, whatever. And then I decided to get away from it. And I went to school, and I ended up on the speech team. And I traveled all over the country doing speech and debate, and I loved it.
Wow.
Then I decided to merge the two things together and had no idea that was what I was supposed to be doing. And now this, I do the podcast because I love public speaking and I love doing this and I love animals. And I'm so blessed to be able to meet people like you through doing the podcast and putting those two loves together.
Well, I was an anthropology and sociology major, and so who knew? And I always wanted to be a veterinarian, but back in the day, I hate to be dating myself, the equine veterinarian that we had said, well, if you want to be a vet, women don't get into vet school. And if women get into vet school, he probably said girls, so he was probably more condescending than that. And
Right.
he said if girls or women or whatever get into vet school, then they have A+ averages, and that's that. And I wasn't an A+ student. Just never was.
Yeah.
We thought, well, there you go.
Yeah.
And then I had a couple of negative experiences, which got me off course, which might be similar to you, might not be, I don't know. And I went to my advisor in anthropology and sociology. She was the most amazing human being. And I said, I love anthropology and sociology, but there's nothing I want to do with it. And I said, I don't want to teach. I don't want to go on digs and whatever. And she said, well, what did you want to do? And I said, well, yeah, I wanted to be a veterinarian, but, women don't get into vet school, and I'm not a straight A student. And she said, now I'll tell you. She said, if you want to be the first woman president in the United States, you can absolutely be that. And I thought, whoa, no, I don't think I want to be that. And she said, if you want to go to vet school, she said, you just set your mind on that. She said, you can absolutely go to vet school. And when we have impactful people in our lives, it's pretty amazing what can come out of that. So I said,
absolutely.
Okay. Because I was totally sold off of it. And I had a terrible experience with that equine vet, and he did some really bad things when I was a young child and talk about impressionable back then. I mean, when you're in college, you're not nearly as impressionable as when you're a little kid. I mean, he snapped a bird's neck in front of me. And I thought, well, if that's what it is to be a veterinarian, I don't want to be a vet. And I brought the bird to him because I said, can you help me? I found this poor little bird fell out of the nest and I want to help the bird. Because I was like you. I was all about animals and helping animals. And I was all around animals and horses and, dogs and cats and, anything animal. I was all about that. And he said, oh, I'll help this bird. Here, hand the bird to me. And, I'll tell you, what. And he snapped the bird's neck in front of me and handed the lifeless body back to me and said, well, this is for the best. And I thought, if this is helping animals, I'm not doing it.
No part of it.
I just turned away from veterinary medicine for all those years until, it got reawakened when I had an awakening in vet school. And I thought, oh my God, I'm halfway through college. I love anthropology and sociology, but I don't want to do a bloody thing with it. Now what am I going to do? But I do think that anthropology and sociology was an amazing meld with being a veterinarian and even a homeopathic veterinarian, because it's looking at life and society and people in sort of a different way. I think it set me up in an amazing way to be able to work with and communicate with people. And without that dual degree, I don't know. I might be just another vet. I hope I'm not just another vet.
You're not. You're not. And I'm so blessed to know you and have, just another connection with somebody that reassures me that I'm on the right path. Because I told you, I don't know that much about homeopathy. I'm beginning to learn it. I've spent so much time studying nutrition and learning nutrition that I kind of forgot that there are these other, and that's partly because I thought, well, I'm not a veterinarian, so I would never be able to help somebody with homeopathy, so I can do nutrition and not get in trouble with that. And so I focused so much on nutrition and forgot that I can still direct them to veterinarians that are homeopathic. And so I'm excited to learn more with you and Dr. McCarran and continue on that path. So
we'll get right into your space with homeopathy. We won't have any trouble doing that. And I'm so blessed to have met you, and I really appreciate you having me on, and it's an honor, to be able to come on and be able to dialogue with you. I immensely enjoy it, and if it weren't for people like you, we wouldn't be forwarding a movement that the needle needs to be moved so badly.
It needs to be, and it's going so slowly.
Yes.
But you're right. It needs to be moved, and it's just too slow. And together, and Joey's legacy and all the stuff that we're working on, it's happening. I used to think I would never, ever see dogs stop eating and cats to stop eating kibble. I never ever thought that was going to happen. I thought at one point I wanted to give up and just say, fine, feed them kibble. Fine, feed them processed food. And now I see it. So I know homeopathy is so far away from people's thought process, but I know it's happening. It's coming, and we're getting.
There's a wonderful book that I like to recommend. It was out of print, and then it was back in print. But on my website, if you go under useful links, where I have a listing of various books, and Dr. Pitcairn's book is one of them. There's a wonderful book you can read as a PDF on my website, and it's called Beyond Flat Earth Medicine, and it's written by an MD. His name is Michael Dooley. It's only about 100 pages long. And I really encourage anybody and everybody who might even have an inkling of interest. And it's applicable for people, animals, makes no difference. But it's a wonderful, easy read intended for all audiences. And it will give you a wealth of information of homeopathic medicine. So I strongly encourage anybody to read that, if for nothing else, just for the interest and education of what the heck is it? What does it do? Should I even entertain it for my own well-care or for my pet's well-care? Read the book. It's a fantastic book. I believe that there was a new edition that came out, but you could just read it for free as a PDF. It doesn't look like a link on my website, but if you just click right on the book itself, it'll open up as a PDF. And I strongly encourage reading it.
I'll look at that.
Terrific. It's a great book.
Thank you.
Really good book. So easy read. Thank you. You are amazing. Amazing.
Thank you. No, you are. Thank you so much. To our listeners, I hope that you found some value in what we're trying to communicate to you. It's so very important to think about the future of your pet, setting them up for success. I know it's a little scary to think that your veterinarian can be causing some of your pet's illness. Remember what Dr. Cannizzaro said. It's not that they're doing it on purpose. It's that they don't know what they're doing. So it's super important to trust your veterinarian and look for somebody who's a little more open-minded and understands about what could possibly be happening. We have all of the information to get a hold of all of our guests in our show notes. It's very important. If you want to do a consultation, I highly recommend that you go to the website that we are providing for you to get a hold of Dr. Cannizzaro, who's been just fabulous. So please, if you are listening to our podcast or watching our YouTube channel, please like and share it as much as you can. This information is for everybody. It's free information. As you know, I don't do commercials. We're just here to give you some good information. So it's a really great source for you. So thank you again, everyone, for listening and liking and sharing. And thank you again, Dr. Cannizzaro, for being here. It's just been amazing.
Thank you so much. I really appreciate it. And thank everybody who was kind enough to hang in there with us and go through the whirlwind tour. Just remember that your veterinarian, your allopathic veterinarian, again, was taught the traditional way of doing things. So it isn't that they're on purpose trying to do as much harm to your pet as they can. That, educate yourself. Knowledge is power, and you only know what you know when you know it. So let's get out there and know something different and something better. Thank you.